Hello everybody and welcome to this morning's Call the Midwife Live, and apologies, we had a few technical issues this morning and I am showing up a little late. So firstly, apologies, and if you've been hanging around going, where is she? We've had our regular 10 a.m. Call the Midwife Live for a while, so I am super sorry about being late, but I am here now and I am here to answer any of your questions that you might have around pregnancy, birth preparation, early parenting, whether that's breastfeeding, sleep and settle, navigating as well this fourth trimester in terms of your own recovery, or establishing different rhythms or sleep routines for you and your partner. Whatever it is, we are going to talk about it this morning. So first and foremost, you know what I always want you to do is to say hello. Let me know who I'm speaking to. I'm sitting in this little room on my own with, of course, Junior is always here with me, ready to answer any of your questions. But I love to know, where are you watching from? Who's watching? Say hello, and let me know either how many weeks pregnant you are or how old Bub is. That's what I love doing, getting to know this gorgeous community. We've had lots of questions. Sorry, I've been running. So Sue has asked for more info on heat, and I'm assuming that's heat rash. It says heat rush, which is what I'm currently experiencing probably on my neck. Absolutely, I can do that for you, Sue. Hi, Louisa, here in Sydney with my 2-month-old bub, Thomas. Oh, how adorable, Louisa. I think I need some photo updates from you all. I love when you all send in your photos of when your babies are born, but I also love seeing as they get older. So a lot of you have been asking about the choking masterclass. So last Thursday night, we hosted a masterclass on what to do if your baby chokes. A few of you weren't able to make it, and I totally get that. That's, you know, mum life or settling newborns, or some people had sick babies. We will be doing another course, so keep your eyes open on the socials. I will make sure that we do another one because I know a lot of you missed out on it. So we will put that up, and we'll probably try and give you a bit more notice as well, and we'll keep a replay available for a bit longer. So we're learning with you, so I want to make sure that as many of you see that as possible. Lou, hi, Edwina Lou from Tamworth, 28 weeks. Thanks for Thursday night's live. It was great. My pleasure, Lou. Lou, I was just saying that a lot of people who registered, heaps of you were there, but some weren't able to make it. So we will redo that. I think particularly as many of you are starting to navigate introducing solids as well, it is a super important topic that we're talking about. I find as well, definitely an area that's not covered is around that early sleep as well and what to expect. So we'll talk some more on that. Beck, good morning from Perth. Barbie's 12 weeks old and asleep on me. Oh, Beck, that is lovely. Enjoy that time. It does pass quickly, but when you're in the trenches, I know it can be tough. I hope you're getting some rest as well, Mama. Jade is 34 weeks and Bub's in the 12th percentile. Is this concerning, as she has always been small? She has super strong movements and I've been told this is good. Jade, that is such a good question. It's actually really lovely to see this from the other side, because I get a lot of mums who jump on this page and share with me and let me know. I should also say we've got our own little online community. So if you haven't already joined Birth Beat Tribe, put that into your search engine in Facebook. You can come and join our community of other expecting mums and new parents as well. But Jade, often people are talking because they've been told that their bub is on the larger end of the percentile, and I think it's good to be able to show that percentiles, so we've got from 0 to 100. That's what makes it a percentile. So every baby has to sit within that 0 to 100. That's how percentages work. But I think there's always going to be the average in the middle, but there are always going to be babies on the smaller and the larger end. Where we get concerned as midwives, obstetricians and care providers is that, say you've been, so I'm going to make a little scale here, and say you've been tracking on the 10 to 15th percentile the whole time, that's not concerning to us. But say you've been tracking along at the 10 to 15, or let's say, for example, the 50, and you drop down to the 10 to 15, that's cause for us to not necessarily be concerned, but to look at the bigger picture, see if we need to do some more imaging, see what's going on, see, is this for some reason the baby's not thriving? Is there something up with the placenta? You know, it causes us to dig deeper and do further investigations. Whereas on the flip side, if your bub has been on the 90th percentile, you know, from early in your imaging and stays on the 90th percentile, again, that's not a huge concern. My son Theo was on the 97th percentile and he was a biggish baby, but he stayed around that, you know, all through my pregnancy. So it wasn't anything to feel concerned about. What I worry, or when we are concerned, is if those percentiles change pretty significantly. So please do not be worried about Bubba Jade being on the, what did you say, the 12th or 15th percentile, 12th percentile. Super strong movements. You're probably just having a smaller Bubba, and that's absolutely fine. It would be interesting to know if you and your partner are bigger or smaller people. So my little Theo, he was born at 4.2 kilos, but my husband's a big dude, so it's not a huge surprise. And I was a big baby. So that is definitely good for us to be able to discuss that there's going to be bigger babies, there's going to be larger babies. That's absolutely fine. Jessica, hi from Brisbane. Love learning from you. Oh, Jessica, that's lovely. 15 weeks. Congratulations. Have you been well? You know, you're through the first trimester now, so that's fabulous news. Hello. Now, I had a couple of questions that were also sent through via Instagram stories, which I'm going to answer. If you've got any questions, pop them here in the comment box. If you also want to ask them anonymously, you can just DM me and I will answer those in stories throughout the day. Jade's just said thank you, my absolute pleasure. One of the questions was around when I'm introducing solids, and I want to actually ask you all this. I don't often talk about different products and things that I feel you need to buy or not buy, only because I definitely err on I feel like as mums, and particularly first time or new mums, we feel like there's so much we have to buy or consume, or we're pretty marketable in terms of buying cute little outfits and different things like that. And I'm just always saying, please don't put yourself under any financial pressure. Less is more, do you know what I mean? Baby really just needs lots of love and cuddles and undivided attention. That is definitely going to be the most valuable thing for your baby. They need somewhere safe to sleep that meets SIDS and kids requirements. They need a way for you to transport them. So essentially a pram, a car seat, a baby carrier, however you're going to carry your baby around. And they need some sort of stroller or pram. And again, really that's not an absolute requirement in the early days, particularly if you're planning on baby wearing. But it just makes life pretty easy. But like, it's kind of, there's not a heap of stuff that you need. But one of these questions was around about to start introducing solids. And I explained on the Thursday night live that when you do start to introduce solids, it should not be with bub, you know, lying down and you're feeding puree like this, or in a pram or in a rocker. The baby needs to be sitting upright in a high chair and able to sit up, because that will dramatically decrease their chances of choking. So this mother just said, do I have any recommendations around a high chair? And her words were actually, is the IKEA one good enough? So I'm a huge fan of the IKEA one, and I'm going to tell you for a couple of reasons. It's light and easy to move around the house. So if you just wanted to pick it up and move it from the table to the kitchen bench to outside, wherever you're eating with bub, it is super handy in that it's very light. You can actually just lift it up and carry it with one hand. Plus what I love about the IKEA, and this is in no way sponsored, you know, IKEA, feel free to send me a little thank you. But it's super easy to clean as well. So I find a lot of high chairs, particularly those ones that have padding for the baby at the back, or little toys attached or things like that, they're not needed. You just need the absolute basic, and anything that has a lot of that padding and cushions also makes it super duper messy. So eating is going to be messy for those first few months, well actually those first few years. So a high chair that is easy to clean is also very important. So I'm a huge fan of that IKEA one. If you don't know what I'm talking about, I'll put a link in stories to it. It's just white and grey. It's got a little safety belt. It is very basic, but it works a treat. Sorry, I missed some questions there, so I'm just scrolling back. Jade's just asked what we talked about earlier about small for gestational age or being on the smaller scale percentage-wise. Does being smaller usually change a due date? No, Jade, it won't if you've continued to be on that sort of smaller end of the percentile. Where sometimes it can affect your due date is, again, if Bub's been tracking at like 60th percentile and drops down, it might be that the placenta's no longer feeding all of that beautiful nutrition to Bub, and sometimes that is cause for us to induce you earlier. But if Bub has consistently been on the 12th percentile, that's not really an issue. Oh, Jessica, terrible morning, all day sickness, hoping it will ease shortly. So am I. I think you said you were 15 weeks. And I know, why do they call it morning sickness? It's just like this constant all day nausea, isn't it? A few of my tips, and I've got some on a blog there for you, just in terms of what you can do to help with the morning sickness, little and often in terms of amounts of food. I know that traditionally we're very used to having breakfast, lunch and dinner. That's the way most of us eat. But think about having a early snack even before you're getting up in the morning. So storing some dry crackers or salada or sayo biscuits, something next to your bed. And before you get up in the morning, chewing on some dry biscuit, it actually helps. So all the acidity in your stomach is increased during the early stages of pregnancy, and it can be what makes you feel. So if your stomach is empty, it doesn't have something to be working on, and that's what can give you that sort of nauseated, feel like you're going to vomit feeling. So by having some food there, that helps. So little and often, so aim to be having 5 or smaller meals can definitely help with that nausea, and definitely look at staying really well hydrated and lots of rest. All of those things are going to help. If it is really significant, I can also tell you, if you want to reach out, to send me a DM, more medical type things, but there is also, you know, ginger tea, sipping on ginger tea, peppermint tea, all of those things are going to help as well. Tamara, hi from Adelaide, 38+1. Thank you for all your amazing advice. Oh, my pleasure, Tamara. Annalise, hi, Edwina from Western Sydney. Oakley is 11 weeks old. He has 2 sore big toes. Oh, looks like ingrown toenail. Is this common? Annalise, it is super common. So please keep a close eye on those. Are you breastfeeding Oakley by any chance? If you are, squirt a bit of breast milk on those ingrown looking toenails. I know that sounds a bit funny, but your breast milk is liquid gold in helping fight any sort of infection like that. So spray a bit of breast milk on it and just keep a close eye on it. What often happens, and it happens on their fingers, but it also happens on their toes, is that their nails are still super soft and can grow easily into the nail bed. It's also sort of why we say don't cut them or tear them too close. So just keep an eye on that, because it is something that we often see is ingrown toenails. They're not actually ingrown, but it is definitely something. So keep a close eye on it. Just pop a bit of breast milk on it though, and every time you're feeding, just put some breast milk on there. Don't try and cut the nail. Just keep a close eye on it. Jessica, awesome question here. Can babies get PTSD? Now, Jessica, I'm assuming do you mean from the pregnancy and the time in utero if something traumatic has happened to mum, or do you mean from the birth experience? So there is some really interesting research being done into this area, and it's called epigenetics. So looking at what the mother experiences during pregnancy and how that can impact the baby, but even going back a step now and looking at any trauma that the mother experienced even before the baby is in utero. So whether that epigenetics is affecting your eggs before you have your baby. So it's like mind-blowing stuff. I'm definitely by no means an expert in this, but this area interests me. Or are you talking about birth trauma and if the baby experiences birth trauma? From a cognitive point of view, a lot of research would believe that a baby isn't yet conscious or has a consciousness. So sorry, they are conscious, but they don't have a consciousness. Or are they able to remember the experience? Now, a lot of birth healers will also work with adults now and sort of take them back to their birth experience and say that people can experience and remember their birth experience. I definitely don't know enough in this space, so by all means, if anyone wants to send me more information, I think it's really interesting. But from a development standpoint, a traumatic birth can actually impact the baby in terms of spinal alignment or jaw alignment or cranial alignment. So all of those things, definitely if you have some concerns, if bub has difficulty feeding or is appearing to be sore or has a headache, sometimes that can be from a traumatic birth experience, and a lot of chiropractors will see newborns for exactly that. So let me know, Jessica, what you mean a little bit more by that, but I think that's a really interesting area for us to be able to discuss and explore. I definitely just absolutely need to say this, am not any sort of specialist in that area. I just find it interesting. Jamie has said, hey Ed, how bad does coffee and chocolate affect breast milk and what effects do they have on the bub? Good question, Jamie. And again, in our Birth Beat course, so we have a full online program where I teach you and hold your hand through your pregnancy for you and your partner and help you to prepare for your best birth. If anybody who is currently pregnant and feeling a little bit lost or a little bit scared about the big day of birthing their baby, please come and check out birthbeat.com and have a look at our online course. It is designed to take you from a place of fear or feeling anxious to feeling excited, but actually knowing what to expect, what it's going to look, sound, and feel like. That is what I am hugely passionate about doing. You can also do that at your own pace from the comfort of your own home. But we talk about this, Jamie, around nutrition. So not only coffee and chocolate, which both have a bit of caffeine in them, it can impact the baby, and it does go through in utero, but also when you're breastfeeding. So I recommend that you limit your caffeine intake to 1 to 2, so 1 or 2 coffees a day. But in saying that, if you're having 6 glasses of Coke, that also has a lot of caffeine and a huge amount of sugar. So that's gonna, like, you can't be doing the tea, the coffee, the chocolate, and the Coke. So it's looking at your overall caffeine intake. The other thing, particularly with the chocolate, is actually looking more at your sugar intake as well. So once you're breastfeeding bub, you just want to be a little bit conscious of this, because a really high sugar intake can also increase your chances of having thrush. So thrush on the baby's tongue, thrush in your breast and nipple. And the interesting thing about thrush is it actually feeds on sugar and yeast. So it wants you to be having more sugar, so it will make your body be craving sugar. So please just look at a healthy, well-balanced diet, lots and lots of water. If you are habitually someone who likes to have your tea or coffee after you've had 1 or 2 for the day, look at having a decaffeinated option. That will help you, Jamie. Jade's just said, thank you, my absolute pleasure. Jessica, thank you. Yes, definitely a false name. I'll add, yeah, it is a false name. It's not morning sickness. I'll add biscuits to my bedside table. Good. Let me know how you go, Jessica, with that. And genuinely, rest will make a big difference as well. So just wherever you're able to get a bit of rest and lying down during the day will also help with that morning sickness. Don't feel like it's something that you've just got to push and persevere through. Pain and discomfort during pregnancy is not something that needs to be tolerated. There's always something that we can do to help address it. Oh, Jessica, your bub is having open heart surgery in a month. Jessica, how old is bub as well? So Jessica asked earlier about PTSD, and so whether they'll be able to remember the trauma. Jessica, like a lot of us who go under a general anesthetic, and your bub will be under a general anesthetic, lots of mixed research around this, but it's unlikely that your bub will remember this because of that general anesthetic. That's less traumatic because it's done in a controlled situation. So that is a good thing. How old is your bubba? And I'm sending lots and lots of love and happy, healthy vibes to your little bub who's going into surgery. Let us know how bub goes. Louisa has said, any tips on settling bub when he gets put down and stirs without picking him up and resettling him? Yes. So Louisa, how old is bub? Did you say is that little Thomas? 12 weeks from memory? I can't see now because it's, sorry, there's so many people who have jumped in. I think from memory, Louisa, you said 12 weeks. So my first tip is swaddling, okay? So knowing how to swaddle your baby, and again, how to swaddle your baby is on our website, birthbeat.com. You can go and watch some of our free videos on how to effectively swaddle a baby. Babies have what's called the Moro reflex or the startle reflex. So when you put them down, they startle, and that can often wake them up. I base all my information around sleep and settle off Harvey Karp's 5 S's. And really, it's about thinking, Louisa, like your baby, when he was in utero, I feel like I'm saying he, and I hope it is Thomas, was constantly rocked in your belly, moved, shushed by the sound of the amniotic fluid. So it's a dull shh. You heard that when your baby, when you were having an ultrasound or when the Doppler was being done, you could hear that swooshing. Now that is all super comforting to your baby. So be looking at engaging, having white noise, dark room, side shushing or settling. So swaddling your baby, popping bub on the side. So after they've had a feed and you're putting them to sleep, not feeding them to sleep, but putting them awake into their bassinet or even over your leg or over your lap, wherever it is, and side shushing them so they're swaddled. I don't have a swaddle in here with me. I might do something on this on Thursday morning for everybody, because I think it's, would everyone like that? We'll do the 5 S's. I'll show you how to swaddle a newborn. I'll show you how to side settle. I think that will be helpful. So putting him on his side to settle and just a really firm pat on the bottom. So why I'm holding my hand like that is because he's swaddled, but I don't have a swaddle sitting in here with me. I wish I did. And a shh, 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 until you have helped him to settle. We're not putting him to sleep. We're helping him settle. Then you can roll him onto his back so that he can self-settle. That will be hugely helpful, because otherwise they wake up going, why am I here all alone with no comfort or no sound, and I'm feeling really alone, so I'm going to call out. Also, to know the difference between the two different cries, crying up or crying down. Is he actually screaming out for you to come and pick him up, or is he just putting himself to sleep? Super important that you know this information early on so that we can create healthy sleep habits, as opposed to trying to do this at 6 months where it's far more challenging. So I will talk about that on Thursday morning if you would like. Diana has said, can a 5-month-old have a kidney infection? Yes, the simple answer is yes. Why do you think bub has a kidney infection? Is it that there's any blood in the nappy? Is there what maybe urates? Let me know. Is bub distressed? Is bub not able to pass urine? You know, they're all or does the urine smell? That could also be something. Let me know. All right, guys, I'm running out of steam, but I will do a couple more questions. Hi, Edwina, I followed all your lives. My last pregnancy, my baby girl was born via C-section 10 days before due date and is almost 8 months old. Oh my gosh, that's so exciting. She had terrible colic for her first 4 months, not so exciting. And I have been told it's highly likely because she was born early and section. I'm nervous as my next baby is going to be a section likely before due date. I'd rather not go through colic again. Hey, Jenna, reach out to me and we can explore that one a little bit further. There's not anything really you can do to avoid, like you can't, you know, I can't say, but they're like definitively that we can avoid colic, but there is some interesting research that may be helpful. Also to consider, would you consider a VBAC, so a vaginal birth after a Caesar, or trialing a VBAC? Definitely lots for us to explore there for you. So don't worry, I will support you when that next bub comes. Danny has said, hi Edwina, where's the rest of your question? Hi Edwina, big fan, 36 weeks today and I've been following you from the start. Thank you for all your wisdom. Piggybacking on another kidney question here, our baby only has one kidney. Okay, so that would have been picked up on ultrasound, Danny, and surprisingly common. Doc has advised to watch for UTI. Any advice for preventing and identifying UTIs? No, look, Danny, so your doctor will also go through this for you because that is one kidney now. It's that little bit extra sacred. Hydration is really key in helping prevent urinary tract infections. Also making sure, is it a little boy or girl? I think a baby boy, which is good because again, we teach mums how to change, mums and dads, sorry, how to change nappies to decrease the chances of a urinary tract infection. But early days for you, really, Danny, that's going to be for when Bub's a little bit older, because you won't be able to as easily see when they're going to the toilet, how often they're urinating, things like that. But when the time comes, they will be able to go through that with you as Bub grows and gets older. And really in the early days, it will just be around hydration. Probably a good idea for you to express from 37 weeks. If you want to look back at our how to express colostrum videos, that will be helpful to you. All right, team, wait a minute, I've got one more. Preet has said, hi, Edwina, my baby has thrush, which keeps coming back. She's bottle fed, she's feeding fine, we give her medicine. Should I be worried? Preet, can I just say what I see time and time again with thrush is people stop treating the thrush once they aren't able to see it. Most thrush treatments say to continue for 7 days after the symptoms of the thrush, because often they're still there and then they're just starting up again before we fully treat the thrush. Okay, one more. Krista, 37 weeks, low in iron, tips on what to do, have just doubled iron tablets to 2 a day. Yes, Krista, are you taking a vitamin C or a fresh orange juice at the same time as when you're taking the iron? Because by introducing vitamin C, you increase the absorption rate of that iron. Plus, stay really well hydrated because by doubling your iron, it's likely you're going to get constipated as well. All right, team, I have got to jump off. I will be answering any of your questions on Instagram stories. If you want to look at any of our free resources, come and have a look at birthbeat.com. We've got lots of blogs and free videos. If you're interested in any of our online courses or programs, come and check it out. I will talk to you all soon. Bye.